Greetings and welcome to In-Depth. I'm Dike Rostant. From April 22 to 29, the Pan American Health Organization, or PAHO, is observing the 21st Annual Vaccination Week in the Americas and the 12th World Immunization Week under the call to action, Get Up to Date. Each vaccine counts. Now, Communicable Disease Epidemiologist Dr. Franka Vignes, she joins us for a roundup of the week. Thank you so much for joining us, Dr. Vignes. I want to start off by asking for a breakdown of the week. Thank you. What's the rationale behind it, and what are some of the itemized events that would have been taking place?
Absolutely. Thanks for having me. So Vaccination Week, Vaccination Week in the America dates to a 2002 proposal by ministers in the Andean region of South America following an endemic outbreak of measles. And since then, here we are in 2023, observing the 21st Annual Vaccination Week of the Americas. And this is an initiative which aims to promote and underscore the importance of vaccines, as well as to increase the awareness and underscore the need for governments to support the vaccinations of their populations.
And from an endemic outbreak of measles to a pandemic of COVID-19, have things changed? We've heard the term vaccine fatigue. Or what are some of the energies that you've been getting throughout this week in particular? Thank you.
Oh, absolutely. So obviously there's been some vaccine fatigue. If we look at some of these statistics, since 2010, in 2010, for example, there are 6 WHO regions, right? And 6 in 2010, the region of the Americas, which is where we are, North America, Central America, South America, and the Caribbean. In 2010, the region of the Americas had the second highest vaccine coverage rate of all the regions. Now, the region of the Americas has the second lowest vaccine coverage rate. And that decline in the coverage of the vaccine coverage occurred prior to the pandemic. So from 2015 onward through 2021, what we have seen is a consistent decline in the vaccine coverage rate for children under the age of 1. So that decline in vaccination coverage occurred well before the pandemic. So now you asked specifically about the pandemic, and we know what happened there in terms of the misinformation, disinformation, and vaccine fatigue. So we are battling not only the decline in vaccine coverage rates that occurred well before the pandemic, but then because of the pandemic, we're looking at the rise in those who might distort the truth, so that we are facing a problem around false narratives around vaccines, which has been quite challenging.
And does that change the approach in terms of the way you go about encouraging, giving information? Well, I guess it would, because you have to battle more dis and misinformation as well. But how has the approach changed to deal with some of these newest challenges?
Yeah, absolutely. It's a great question. So in terms of, what's changed since, say, 2010, when that decline in that slide, 2015, that slide in vaccination coverage occurred, we've seen an increase in the use of social media. We've seen persons rely on a variety of sources for their information. So we too, in public health, must use a variety of mechanisms to reach populations. We relying not only on the mainstay television and radio. We have to use things like Instagram and, may I even use the word TikTok. So whatever it takes to reach audiences, we must use those mechanisms and not rely solely on the what we've been doing before. In addition to that, though, what has to happen is that countries must improve the level of commitment in terms of strengthening their vaccination and immunization programs. Because what has happened with COVID-19, of course, governments were focused solely on COVID-19, which they had to for a period of time. But what that caused is a decrease in the level of attention that was paid to immunization programs. So we have persons needing routine vaccinations, children particularly here, mumps, measles, rubella, polio, etc. And so more attention now needs to be paid to routine vaccinations. And so that is one of the areas of focus going forward.
No, you say that, and you even talk about TikTok, Dr. Vignes, and I'm just trying to, because I'll be the first to admit there have been occasions when I have made the example of a health-related flyer being just so chock full of information. It's almost as though you're trying to bash your head against the wall. All the information is there, but it's almost as though it's still kind of inaccessible. So I just can't imagine some of the work that has gone into making that information one that is, yes, it's pertinent, but it's also a little more palatable. 15, 20, 30 seconds on TikTok. And it'd be interesting just to find out some of those processes taking that through.
Yeah, absolutely. So, I mean, at PAHO, we use a multitude of plethora of mechanisms to reach the public. So I know for a fact that we use Instagram, etc., in addition to television and the radio. But I think to what you mentioned about making these messages more palatable, more digestible for the public, simple messages that would reach individuals. But what's going to be important going forward as well is to increase the vaccine coverage rates for young persons, for school-age children, for those under the age of 1. Because in the Caribbean, what we're seeing now is that, the 11,000 children under the age of 1 have not completed, not received all of their doses, of their vaccine doses. That's about 1 in 10, okay? And that leaves that population, young children, susceptible to diseases, as I mentioned earlier, measles, mumps, rubella, polio, etc. So we have to reach the parents of these children, as well as to educate persons at their schools, etc., to ensure that they are vaccinated as they should be before they enter schools, etc. But again, we have to be relentless in our messaging, because those who spread false information, they too are relentless in spreading disinformation. So I agree that spreading messages in a format that is more palatable and digestible is going to be important, but it has to be continuous, and we must be relentless as we move forward to strengthen the capacity in countries, not only to vaccinate their populations, but to ensure that and to increase the level of trust between healthcare providers, those in public health, government, and the public as well.
And we have about 2 minutes on this side of the conversation, Dr. Vignes, and I have not asked about almost like the itinerary. What are some of the things that have been taking place during the week? So in terms of those local efforts, take me through some of them. Thank you.
So I think the Ministry of Health, typically countries, ministries of health would have health fairs, talks, etc. during vaccination week. PAHO would support countries in these initiatives as well. But what I want to say specifically and bring your attention to, it's a great success story at the regional level, is that you may be aware that ministers of health attended the 29th special meeting of the COSAD, which is the Council for Human and Social Development and Health. That meeting was held this week in Nassau, Bahamas. And the ministers of health agreed to what is now going to be called the Declaration of Nassau. And that declaration was signed at the COSAD meeting earlier this week. And that declaration, the aim of that declaration is for countries to reinvigorate their commitment to strengthening their national immunization programs. And I think that's going to be a great win. And it's only, it's notable and laudable that the Declaration of Nassau was signed and agreed to by health ministers during vaccination week. So we can look forward to countries in the Caribbean strengthening capacity and their attention to their national immunization programs, as I mentioned earlier.
All right, and on that note, we take a short break. We are speaking with Dr. Franka Vignes. We are inside Vaccination Week in the Americas. Stay with us. We'll return with more. Welcome back. We are speaking with Communicable Disease Epidemiologist Dr. Franka Vignes. We're doing so inside Vaccination Week in the America 2023. And I want to go back to something you said about the declaration of Nassau, please, Dr. Vignes, which is fabulous news. But in terms of building capacity to deal with the national vaccination programs, what are some of the challenges? What are some of the things that the health ministers would have been speaking about, saying, okay, well, yes, we need a little help here. Yes, we need some resources here. Help us build capacity here. What are some of those things that you would have been hearing?
So absolutely. One of the things we heard, of course, is the level of vaccine fatigue throughout the Caribbean and countries and stakeholders who are involved in vaccinating their populations did mention, of course, that vaccine fatigue is a problem that we have to deal with. But again, we have to be relentless in our approach, because those who spread mis and disinformation too are relentless. But I think in terms of specifically, if I can speak to Trinidad and Tobago specifically, PAHO, Trinidad and Tobago office, is working closely with the Ministry of Health and in the provision of solar-powered vaccine freezers. And to date, 44 of these solar-powered vaccine freezers have been provided and installed in Trinidad and Tobago, and 24 more of these solar-powered vaccine freezers will be provided in the short order. Similarly, in other countries in the Caribbean, there's a myriad of other programs and initiatives that are being implemented or have been implemented to improve the vaccination coverage. Also in Trinidad and Tobago, working with one of my colleagues, Dr. Karen Broom, at the sub-regional level. Dr. Karen Broom visited Trinidad and Tobago in late 2022, and we held a workshop for stakeholders to review the protocols and procedures for a response in the event that there would be a measles outbreak, for example. So this is the type of work that we are doing with countries, strengthening their capacity to respond to potential outbreaks. And this is the type of these are the types of support that that countries are requesting. So just if you may or may not know that in 2016, measles was declared to have been eliminated in the Americas. That's in 2016. Fast forward to 2023, and now we are seeing measles outbreaks throughout the Americas. So we have a lot of work to do. And I think that the level of support and the initiatives that are required in one country may be different from another, because different countries may have different gaps or different challenges to be overcome. Of course, one of them is funding. Countries have various priorities. And so one of the areas of support that PAHO can provide is technical cooperation, where we can assist with implementation of these vaccine preventable activities for vaccine preventable diseases.
And that just brings me to the point, and I'm glad that you talk about that level of support. So I want to ask specifically about the way that PAHO, WHO connect and afford that level of support, level of engagement to ministries in particular. It could be the one in Trinidad and Tobago, it could be regionally. I know definitely one would be that technical expertise that you just mentioned, so that everybody doesn't need to make the same mistakes or face the same challenges as opposed to saying, okay, well, this worked here, and these are possibly some of the reasons why we have worked in this space. But what is some of the other work being done in conjunction with the Ministry of Health? Thank you.
So thanks for that. So in addition to work being done in conjunction with Ministries of Health, so note that PAHO country offices work to support and ministries of health in each of the countries where these PAHO offices exist. Note that there's also a sub-regional office as well, and we also would liaise and communicate and with the CARICOM, and so there's a level of the relationship there as well, and we provide support through that mechanism as well. But specifically, as PAHO would provide support to countries that requested of PAHO, and of course, then we make recommendations to countries, which then they, as countries, can determine whether or not they will implement. And of course, in terms of, you mentioned, what do we do with countries in terms of, other than providing technical support in terms of implementation, just in terms of basic training programs. So in terms of last year, it was a continuing, this is a initiative that started in about 2020 in several countries in the Caribbean. And one thing that we're working is to implement a systemized approach to reporting of adverse events supposedly attributable to vaccines. And that's something that's being worked on in various countries, Barbados and Trinidad and Tobago, two just readily come to mind. So there's a plethora of activities in terms of providing equipment, as I mentioned earlier, in terms of providing technical cooperation, in terms of strengthening the systems that already exist, and third, in terms of introducing and implementing new systems that can strengthen what already exists in countries.
And looking at that systemized approach, working towards that, I love the fact that you're able to give me these amounts of information. A startling one is the one that you said is almost as though it's 1 in 10 children under the age of 1 have not gotten the vaccinations that they should. But do those stats also give an idea of where, or other demographics in terms of where individuals are from? Is it more urban areas, is it more rural areas, which may also inform how these challenges are addressed?
Yeah, Dike, that's an excellent question. And that takes me to what we call the social determinants of health. I mean, and what are these social determinants? Where you were born, where you were raised, where you live, where you go to school, where you work, how you work, your level of income, your access to power and money. And so these are the social determinants of health that often affect simple access to vaccines. And so that is one of the aims and initiatives, the raison d'etre for the Vaccination Week of the Americas, to reach out to vulnerable and marginalized subpopulations. And again, as you mentioned, these are simple barriers to vaccines. So it may sound simple that there are health clinics and et cetera that have the vaccines, but persons have to get to the health clinics. And how does someone who has a very low income, who has to then probably take public transportation to get to a health clinic, all right, with a young child, and then travel back by public transportation, sometimes 2 or 3 taxis or buses, etc. So there's, so we have to pay attention as well to these social determinants of health that often are barriers to persons accessing healthcare and simply accessing, these vaccines. In addition to which, persons with unfavorable social determinants of health are persons who are more likely to believe the misinformation around vaccines. And so that population, persons who have unfavorable social determinants, have another layer, another challenge here in terms of not being able to often assess the information accurately in terms of their response. So you're asking what these barriers are, and there's several. So, countries have to determine, simple common sense approaches to reaching those vulnerable populations, as I mentioned. And they're often, the populations are on the periphery of large cities or cities, and populations in rural and semi-rural areas that typically do not, where vaccine coverage rates tend to be lower.
And with that in mind, I want to thank you so much, and I'm glad that we were able to get that piece in. Communicable Disease Epidemiologist Dr. Franka de Vignes inside this Vaccination Week in the Americas 2023, reminding you that the hashtag or the theme is each vaccine counts. Get up to date. And this has been In Depth with me, Dike, on behalf of the entire TTT News team. Thank you so much for joining us.